Good afternoon, everyone. My name is Katie Flores, and I'm going to be moderating the program today. So I'll be keeping an eye on the chat. If you have questions throughout the presentation, you can feel free to add those there. We'll make sure we have time at the end of today. We'll save some time for questions. So at this time, I would like to introduce Kimberly Knight. She is the Director of the Caregiver Support Program at the Senior Source.
Hi, everyone. Thank you so much for joining us today. As Katie said, my name is Kimberly Knight. I'm the Director of Caregiver Support at the Senior Source. And we are so happy that you're joining us today for Community Conversations for Caregivers with the Dallas Area Agency on Aging. We're totally excited to have this program because as caregivers, often you're wanting to know about different community resources that are out there, respite, home repairs, just different financial assistance, utilities assistance, just different questions you might have. And you always want to know, like, where do we get these resources? We hear about them all the time. You know, who do we contact in order to get these things for ourselves and for our loved ones? So we have one of the great community partners joining us today to talk all about that. Before we go further into today's program, I would like to just share a little bit with you about the Senior Source and about the Caregiver Support Program itself. So the Senior Source is a nonprofit organization, and we have been serving the Dallas community for 61 years. We help anyone, any older adult that's 50 years and older in various areas. The Caregiver Support Program, however, within the Senior Source primarily focuses on the caregiver. We help any caregiver that is taking care of someone 50 years or older, and we provide them with information referral sources to different community resources. Our number one goal as the Caregiver Support Program is to provide resources and support to individuals and families so that they feel confident in their role as a caregiver. As you know, many times as caregivers, you're not prepared for the role. You're just kind of thrust into it. Something happens to your loved one and you find yourself having to step up to the plate to take care of them. Oftentimes that comes with feelings of just not knowing what to do. So we're here to help you feel more confident in that role and be a guide and light in that sense. We're also here to help you, the caregiver, remind yourself to put on your oxygen mask first and focus on yourself, your own mental, physical, and emotional well-being. If you've been a caregiver, you know how stressful it can be. And sometimes your health starts to fail because your attention is so focused on your loved one that you forget to go to your own doctor's appointments and take care of your own medical needs. So we're here to be a support system in that area to remind you to take care of yourself first, because you can't care for someone else if your health is failing. So we're here for you. And we have different programs that we offer along those areas. So just to share with you, in particular, our programs and services, we provide information and resources for support and assistance. We work with agencies like the Dallas Area Agency on Aging to connect you with those needed resources. We provide care consultations with individuals and families. So a care consultation is when we sit down and we talk to you. It could be in person, it could be in virtual. It's sometimes with the individual, but it could also be with the family members that are helping to care for that loved one. And we listen to you about specifically what's going on in your caregiving journey. And we provide you with information and resources and just advice to help you make the best informed decisions to take care of that, to take care of your family member. We also have support groups. The support groups are how we go about helping with that, your mental and emotional well-being. If you've never been a part of a support group, I encourage you to do so. It's a great place to meet other caregivers, to vent, to just share, your ups and downs on the journey, but also to get some great advice. Sometimes you can meet another caregiver that's been there and done that. And so they may have a tip or two to just teach you how to navigate through what's happening with your loved one and the best way to assist them. Then we have caregiver education classes, much like what you're participating in today. And we have an education calendar on our website that has a listing of our upcoming education seminars and workshops that we provide to the public. They are all free of charge, but we do require that you register to attend. And then last but not least, we provide incontinence supplies. Incontinence supplies, if you are using them, you know how expensive they can be. And so we're here to just be a helping hand in that area and provide free incontinence supplies when they're available to us. We have Depends, we have underpads, and sometimes personal hygiene wipes that we can share with you, and just be of a help in that way. So those are all the programs and services we offer through the Caregiver Support Program at the Senior Source. And the best way to contact us in order to receive those services is to contact us by calling us at 214-823-5700. Again, our phone number is 214-823-5700. So you can also email us at csp@theseniorsource.org. Again, that email address is csp@theseniorsource.org. And Katie would put the contact information also in our chat area so that you can contact us if you have any other needs or resources that we can help you with. Are there any questions? Okay, so I am going to now change gears, and we're going to transition our program to Donna Alexander. Donna Alexander is our featured speaker today. She's with the Dallas Area Agency on Aging, and her title is the Director of Access and Assistance. Donna, I like to say, is the guru of all things in this department when it comes to caregivers and connecting them with resources. And she's the perfect person for us to talk to today and hear more about how they can connect you with services and what's available for caregivers. So I am going to turn it over to Donna now. And Donna, we are excited to hear what you're going to share with us.
I'm good. Good afternoon. As Kimberly mentioned, my name is Donna Alexander. I am the Director of Access and Assistance Services, and you'll hear me talk about that for the Community Council of Greater Dallas. Okay. Before I get started, though, I would like for you to introduce yourself, if you can. We'll start with Terry Contreras. Okay.
Okay. All right. Sorry, I had to plug in my.
Okay.
Hi, good afternoon, everybody. I'm Terry Contreras, and I also work at the Senior Source in the Caregiver Support Program. And I assist seniors as they call in. We like to talk to them, identify what their need is, and then help them at that point to go through their journey in the best way possible.
Okay. Next, we will have Sandra Lopez introduce herself.
Yes, good afternoon. My name is Sandra Lopez, and I also work for the Senior Source, and I'm with the Money Management Program.
Okay, that's good. That's good information to know, Sandra. I always like to know the person with the money.
Okay, thank you.
Next, we will have Lena Anderson. Lena, I'm starting to get to know you because you're sending me lots of referrals, and I like that.
I'm glad, and I appreciate all your help. Let me turn on my video. Hello. Yes, Donna, thank you so much. You've been very helpful to me, and I like working together. My name's Lena. I work with the Senior Source as well under the Caregiver Support Program. I'm a caregiver support specialist like Terry, and so we just we send referrals to our clients, care consultations, basically everything Kimberly said prior, but happy to be here.
Okay, thank you. And next, we'll have Erica Sampson introduce herself.
Hello. Hi, Miss Donna. Thank you for being here today. I work with the Senior Source as well, and I'm a senior financial coach. So I help with a lot of frontline income crisis type conversations. So I'm really looking forward to this. Thank you.
All righty. And Juan is here. Juan Rodriguez is here to help me with my slides because we've been having some problems with them. So he is just here. I'm using him as a guide today. So that is why his name appears on the screen. The first thing that I want to talk about with you today is first to have you understand the difference between the Community Council of Greater Dallas and the Area Agency on Aging. Now, Juan and I, we work for the Community Council of Greater Dallas, but we work in the department. Let's see if we can see this. Can you put that up? We work in the, I wanted to talk to you about the Community Council and Dallas Area Agency on Aging. And as I said before, there's a difference between the two. Juan and I are employees of the Community Council of Greater Dallas, and therefore our check is written from the Community Council of Greater Dallas. And under the Community Council of Greater Dallas, there are 5 umbrella agencies. And it's, as you can see on the screen, it's 211 Texas, it's Economic Mobility, it's the Dallas Area Agency on Aging, and you'll hear me refer to it as DAA. We have Community Wellness, and we have Healthcare Navigators. But today, we are going to just discuss the DAA, the Dallas Area Agency on Aging. And the mission for all of these programs is to improve the quality of life, especially for our seniors, and especially for families, and to take them out of poverty or try to alleviate poverty and foster independence. We also foster independence for a lot of our seniors. And I'll get into that in just a little bit. And we also try to connect people to the resources they need. And I'll give you an example of that. Basically, if we have someone come to us and they say, oh, we need grab bars, but I'm also, I need to talk to someone about me not being able to, I need help with my, she's deaf. So we'll refer them to the Deaf Action Center. And basically, we'll follow up with them to make sure that they receive the services that they needed. Next slide, Juan. The Older Americans Act. I can't talk about the Area Agency on Aging if I do not talk about the Older Americans Act. The Older Americans Act of 1965 was a federal initiative. It was aimed at providing services just for older adults. And it became effective in July of 1965. And I want to ask any of you, I don't know, because every May we have a health fair, and usually whoever sponsors it, they usually name it after that person. But we usually call it the DART Fair because DART has been sponsoring a lot of our Older Americans Act month. So if you've ever been to this, it is the celebration of the Older American Act that was reauthorized in 1973. And basically there's games, there's prizes, the seniors dance. I mean, it's just fun. Last May, it was exceptional. We had food giveaways, prizes, everything. So if you've ever been to one of those, that is the celebration of the Older Americans Act. And then when it was reauthorized in 1973, it created the Area Agency on Aging. So that's how the Area Agency on Aging came about. That is its history. Next slide. The AAA, just to give you an idea of the AAA is a public nonprofit agency that was designated to address the needs of older Americans at the local state levels. It comes from the federal government, it trickles down to the state, and then it comes locally. And when I say it comes, the money comes, the funding comes. In Texas, most of our AAAs are established in counties. I'm from Louisiana, so our AAAs are they're established in parishes, but usually in Texas is counties. So the eligibility criteria became to apply for this program is you have to live in that county. There's a AAA in Denton County, there's one in Tarrant County, they're all over the place. But if you come to me and you say, oh, I want to apply and you live in Denton County, I'll point you back to Denton County because you do not live in Dallas County. So everyone we service must live in Dallas County and they must be 60 years and older. Next slide, please. The Access and Assistance Department. If we didn't have an Access and Assistance Department, we couldn't provide the services that we needed to provide for our seniors. I'm the director, of course, as I previously introduced myself, and I direct a staff of 6 airmen, and I direct 15 contractors. And if we don't have a contractor, we can't provide the service. So basically, they play a very important role when it comes to providing service to our seniors. And as I mentioned earlier, our department not only provides services, we also coordinate services to other agencies. Whether the services are provided by AAA or coordinated with another agency, follow-up is required by our airmen. Next slide, please. Access and assistance programs. Now we get funding from the state. As I told you, it trickles down from federal to state. We get funding from the state for 2 programs, and that is the Care Coordination Program and it's the Caregiver Program. And the Care Coordination Program can be defined as a household of 1 senior member who is attempting to remain independent while residing in their home. And you remember I talked about the mission. That is the mission, is to make sure that they can remain independent in their home. You might have a senior who has just gotten out of the hospital. She doesn't want to go anywhere. She doesn't want to go to rehab. She just wants to be in her home. And she might need some grab bars put in her shower. We do that. We will do that to help her, or she broke her arm and she might need some home health care. We do that because we're attempting to keep her independent. I don't know if you talk to most seniors, you'll find out that no one wants to go to another place. You know, and my daughter always tell me, you know, I'll take you in. It's like, I don't want to come to your house. I want to be in my own home. And most seniors feel that way. The caregiver program, on the other hand, can be defined as a household of 2 individuals, where you have a caregiver and a care recipient. And here the caregiver is assisting the care recipient with their daily living activities. You know, they might be helping them shower, they might be helping them go to the bathroom, things of that nature. Next slide, please. And these are our program services, and they are the following, and I'll explain each one as I go through them. The residential repair, minor repair, $5,000. Now, I did hear that due to the COVID and everything has just skyrocketed, they might go take their from 5,000 to 10,000. And every time I have a meeting with the state, I always ask them, are you going to change it yet? Because it's really hard right now doing minor home repair for $5,000. If we do not do major, but as I say, we do coordinate services. So if you need major, we usually refer you to the the residential major repair program. And that's with the, I think it's with the county or the city. The next one we have, and well, let me get back to residential repair. We do things like grab bars I mentioned. If the carpet is bunching, we will take it out and put in some floors where you won't fall. Everything that pertains to safety and health. We do no cosmetic. Everything has to be, if basically you need a shower wand or you need a shower chair, we will do things like that because that will keep you safe. Chore services are basically very expensive. we have cut chore services down to only 2 trees. I don't know if you remember when the storm came through last year or the year before, we had a lot of trees that had gone down. We had a lot of trees that needed to be taken down, to be trimmed. So we started taking down trees. And I don't know if you've ever had a tree taken down, but it's very expensive. So after we did that, we decided, well, we spent too much money. So right now we are trimming only 2 trees. The next program we provide, service we provide is health maintenance. And Kimberly mentioned this in her presentation. We always do health maintenance as well. And I want to remind you that I also have money in this service, whereas I don't have any in residential repair and chore, but I do have in health maintenance. And that's your insure, your wipes, your bed pads, your diapers, your pull-ups, things of that nature. So it would be a good idea to call in if you need it right now, because I don't know how long that money will last. Legal services, basically we have 2 contracted attorneys. We have Steve Holman and Rosemary Redmond. And what they basically do is probate, wills, and consumer issues. And the consumer issue, sometimes it takes a little bit longer, but the probate and wills and powers of attorney, we get those done pretty quickly for the person who needs them. Also, if there's a report of abuse, we also take that. We also have the attorneys look into that as well. Transportation, we have transportation with a contractor with Lyft, and Lyft will provide transportation mainly to doctor's appointments, mainly to the supermarket, things that mainly the clients, what they use it for is mainly doctor's appointments. We do have people who are cancer patients and on dialysis. We try to keep those people on our transportation system due to their illness. Personal assistance, and I just want to explain to you, personal assistance is a lot like respite, but it's only one person. And it comes under our care coordination program. If you, like I mentioned, if the lady got out of the hospital and she needs someone to help bathe her and shampoo her hair, and it's just her, she's living by herself, that will go under personal assistance. And basically what happens is after the care manager does their assessment and their care plan, they usually give them a certain amount of money to use so we can bring in home help. We do have several providers who does this for us. Income support is basically what it says. Income support is for rent, it's for a mortgage, it's for gas, water, electric, things of that nature. And the biggest problem I see with income support is that we must get a W-9 from the mortgage company or from the apartment management. And also, this vendor form that we do, it has to be done by the management program in a timely manner. And sometimes they don't want to do it. And when they do that, there's nothing we can do, but we must have it, because I don't know if you remember on the tax form, if you receive at least $600 for that year, it must be reported to the federal government. So it's very important that we get that vendor form, unless we get audited for not having it. Respite care, I'm sure a lot of you are familiar with respite care for the caregiver. They must live together. I have a lot of people who are living out of town, and they'll call me and say, I need you to give respite care to my mother. She lives alone. Usually when that happens, I put them on the personal assistant. We have 4 types of respite care. We have a senior companion program that we contract with the Senior Source with, and that's basically a program where they just need a companion. They need someone to read to, talk to, things of that nature. In-home is basically when the home health agency comes to your home, and they will basically be there maybe 2 to 3 hours per day and will help that person to give the caregiver a rest. The caregiver might want to take a nap. She might want to run to the store. She might want to run other errands. Well, having that person at home for 3 or 4 hours really helps her a lot. Out of the home, we have Friends Place. It's an adult daycare center. And if the person, let's say the caregiver works part-time, she can, they pick up as well, but she can drop, let's say a loved one to the adult daycare center and pick her up in the afternoon. And basically have an outing for the care recipient and a peaceful mind for the caregiver. The ORC, older relative care, it used to be called grandparents raising grandkids. They changed it to older relative care because it doesn't have to be a grandparent. And basically that's when something tragic happens, or the grandparent or a relative has to take care of a maybe a 5-year-old because the mother died, or the father was never in the home, the mother died. The relative or aunt, the uncle, whoever will need help with that child. And we basically help with that, whatever they need. And if we can't help, there's something like they want childcare for the child. We right now don't have a provider for that. And as I told you earlier, we have to have a provider to provide that services. So basically, sometimes what I do is I'll instruct my care managers, we'll pay your rent, we'll pay your mortgage, and that will allow money for you to do some of the things that you need to do. So just keep that in mind. Next slide, please. These are, excuse me, these are the advantages and disadvantages of these two programs. And when I say these two programs, I'm talking about the care coordination program and the caregiver program. Services are rendered, the positive side, they're rendered at no cost to the senior. It has no income or resource limits. We do not put liens on your home, but we do look up in the Central Appraisal District to make sure you own the home. Or someone who lives in a house own the home, because I'll tell you what, I have run into a lot of problems with someone wants a grab bar in the house and they're renting the house and the owner doesn't want the grab bar there. So we always have to get a release for that, but we have to at least know going in who owns that home. 12-month warranty on all services. We make sure we put this in our contract for our contractors, that if something breaks or they put in an AC unit and all of a sudden it breaks 6 months after they they put it in, we make them go back and check it out and fix whatever the problem is. Now, if that warranty goes past the 12-month period, we cannot help them because all they provide in their contract is a 12-month warranty. The good side about respite is you can have multiple caregivers. You can have the mother, the aunt, and the father, where a daughter might be taking care of those. And we basically will provide for those 3 people. The disadvantages now is that you can only apply once per year. And that's where a lot of people get upset with me when I tell them, we don't have the funding to be continuous. We're not a continuous, we're temporary. We never can be ongoing because as money plays a part in all of that funding. And our physical budget year is from October. It starts in October and it ends in September. So if you applied between that period and you come back and you say, guess what? No, I think I need something else. I can't give it to you because we do have a waiting list. And the waiting list is done according to the date on the referral. And we service by that date. We put them on a waiting list by that date. So if I have a lady that's been on a waiting list for 3 months and you come back and you say, oh, I want some more services, I can't do it because I have to be fair. And basically, that's the main complaint I get from from the clients is that they don't like the waiting list and they don't like that once per year. But it's nothing I can do about that. Next slide, please. If you want to apply for these services, you can apply by visiting our website, or you can call the main number and speak to Paulette and ask for Mario Rivera, or you can call Mr. Rivera directly at that number. And let me tell you, it's not easy, I know, sometimes to get in, because I used to man the phone. And sometimes we'll get 500 calls in a week. And he's just one person. We really need a second person. But right now, funding plays a big role in that. So I told him, when I trained Mario, I told him that, I said, always take their name and number and try to call them back. If you can't call them back that day, call them back the next day. Well, his biggest complaint is this: they never pick up their phone. They never answer their phone. They don't have an answering machine. And if you do that, we can't help you. You must be able to call us back, let us leave a message. If you can't leave a message, there's nothing that we can do. I just want to let you know that this is the end of the presentation. I'm going through the most important points. I could go through more, but I didn't want it to be long and boring. So right now I'm ready for questions if you have any.
And I have added all of the contact info in the chat if you want to grab it. I see a hand up, Erica.
Hey, sorry, I need to cut the light on so you can see me. But I wrote down a couple of thoughts. I know that you mentioned the chore program, and the sound went in and out a little bit for me. So my first question is, can you give me some examples of what are like the chores and things that are usually done under that program?
Basically, we used to do, we would trim hedges, we would cut grass, we would take down trees, we also trim trees, but that has changed. And I don't know if we'll have chore next year, because chore eats up a lot of our funding. So presently, we're only doing trimming trees.
Okay, so that's what I thought I heard. It just got, I thought I missed the part, so I wanted to make sure. Okay, and then I know you said something about people can get services once a year. So like, does that mean if I'm a client who calls in and I have 3 needs, I have to pick one of those things? Like, what is once per year? Is it once per
no,
thing?
but
Or?
right now, because we haven't received funding, we're only doing one service. But if we had received funding, you could get help maintenance, you can get residential repair, you could get income support if you wanted to, and you could get it all in one. But right now, because we are waiting on funding, I'm just waiting, but I just only can do residential repair, so I don't run totally out of money. I work with a budget, and it's hard, really. Believe me, it's hard. It's hard. Any other questions?
I wrote down a lot of stuff, but I think those are my 2 first things for now.
Okay, go ahead and ask. No one else is asking, so
Let me see. Did I hear you say that y'all get like, did I hear you say 500 calls managed by like 2 people? Did I hear that?
One person. We get 500 in a week. A lot of those people go on the callback list because he can't handle it.
Oh, yeah.
And a lot of people complain to me. They'll say, oh, I want to speak to the manager. I want to speak. And they'll complain and say, I've been calling here 5 times and you have never returned a call. We have returned it. But you have to answer your phone, or you need to clear out your voicemail, because after that, we can't spend a lot of time on that. And while he's doing these calls, he has to put them in the system.
Yeah.
So it's difficult. You know, I know because I used to do it, and I would go home just exhausted because it's a hard job. So no one has any other questions? Sandra, Terry, Ashley?
I just had one question. You under, let's see, income support, you said about mortgage. What form is required?
That is a W-9 form, and it's also called a vendor form. It's two forms that the vendor,
Okay.
the person who is saying, and this is the reason, and maybe it'll become clear.
Mhm.
When you ask us for to pay, let's just say you ask us to pay your mortgage, okay?
Mhm.
We can't go in and say, okay, I'm gonna cut a check today and I'm gonna pay it. We can't do that. It's a process. And in order to do the process correctly for our auditors, it takes a while. So basically, when the mortgage company says, well, how long are you gonna wait? We have to wait. Sometimes it's 45 days they have to wait for their check. So they have to be made aware of that you're gonna have to wait for that check, you're gonna have to fill that vendor form out, and you're also gonna have to fill out the W-9 so we can send it to the feds, so we can make sure that you report that money. And a lot of times they don't
Okay.
want to do that. And I never forget, one time I got real angry because this lady was really elderly and she needed it paid. They were threatening to put her out, and the apartment complex didn't want to do it. And so I called an attorney and I asked them if there was any law, and they said there was a law, and they ended up filling out the form. Because I mean, just thinking of her being 87 years old, putting out of our home, I mean, that's just cruel.
Yeah, I actually have a client that I'm wondering is a good referral. He's behind on rent. So I guess my question is, do you come across people who are multiple months behind on rent
Yeah,
and
and
can be
yeah,
paid
I do.
current or?
And basically what I do is I look to see if management is feasible. If management is, let's just say you haven't paid for 3 months because your son was helping you. He lost his job, but now he has a job and he's going to start helping you again. Then I would say, yes, we'll pay the multiple months. But if you have $1,000 coming in every month and your rent is like $1,200, I'm not going to help you because it's not going to do any good. So if you don't have any other questions, that will end my presentation. I hope I was pretty informative for you, and I hope that I'll be seeing some referrals. Remember, I have health maintenance, and I think I have about 15,000, and I really want to spend it. So if you know of anyone that needs this, send me a referral.
So Donna, just so that I'm clear about health maintenance, that's when we're talking about the insurer and other supplies of that magnitude.
Yes, but it has to be a caregiver, because you remember in my presentation, I said there's 2 programs, there's care coordination and there's caregiver. It's under the caregiver program that has all this money.
Okay.
Okay. So
Gotcha.
make sure it's a caregiver that you send.
Okay.
Okay.
Well, I will say, Ms. Donna, me and Terry have a client whose wife is bedbound and they help them with briefs as much as they can. I'm definitely going to do a referral for them to you.
Yeah, and I try to assign those right away.
Okay.
Because the caregiver program, when I first started working, I started from the bottom.
Mhm.
And when I first started working, I wanted to work in our caregiver department. We're all one now because it was so many referrals. But as time went by, I've noticed not a lot of young people want to be caregivers. So we don't get that many caregiver referrals. We get a lot of care coordination referrals because the parent or whoever is trying to stay, I don't want my children to put me in a home. I don't want to go anywhere. So I want to be independent. Some of them don't want to go into assisted living. They want to stay in their own house. So I find myself running out of care coordination money and having all this caregiver money. And that presents a problem for me because my goals that I have to reach has to be equal, and they're not. And so I'm usually scrambling around, I would say August, July, August, trying to meet that goal so both programs can be equal. Okay. All right. Well, Kimberly, that ends it for me. And thank you for this opportunity. I hope my voice wasn't too scraggly. I have problems. I have a Gordy in my neck, and it always affects my speech, you know. And after a while, I just get really, really hoarse. So I apologize for that.
No, you sound beautiful. No worries there. We appreciate you so much for coming on today and giving such valuable information. And it's needed. You know, we work with the population of individuals in the community who are always asking these questions. This is the information that they're searching for. So it's always good to speak to someone within the organization that can share, you know, exactly the ins and outs, what services are available, how to access those services. And as we know, because we do this on a regular basis, we know things change. And so just to be able to even get the update from our perspective is a great help. So we really appreciate you and thank you so much for today's presentation.
All right. Well, thank you. Thank you. It was my pleasure. Okay.
All right.
All right.
Thank you,
Bye-bye.
everyone. Bye.